Dear all, shall we start already? I think we still have some people that are not, that will be coming, but I believe that we can be starting our event. My name is Victoria Panova, for those of you who don't know me. I'm the co-chair of the Civil BRICS process, but also scientific head of their BRICS Russia Expert Council. And as you all know, we've assumed, our country assumed chairmanship in BRICS January 1st this year. Very interesting, not always positive year indeed, but we hope that our chairmanship in BRICS will be remembered not just for their problems brought about in 2020, like pandemics, like some other turbulent crisis in political area, like fires in Australia, etc. I hope that it will be remembered also for the positive outcomes that our chairmanship will be bringing. And I'm firmly believe, in fact, that not a single government or set of governments can come up with the ideas without their academic community, epistemic community, without their civil society. And that is why it is extremely important to have a full-fledged civil society involvement, all the intellectual abilities of all the citizens of BRICS countries, but not only. Thus, we are launching, this is the first roundtable this year for international arena. So we are launching a series of roundtables to gather interests, views, comments, initiatives of the wide public civil society community from all over the world. Stepan will probably be able to explain a bit more about that as a coordinator of the CIL process. But our work will be structured around 8 working groups. And this roundtable is particularly overseen by the group on health and food security. Our particular topic of this event is how the COVID pandemics is influencing our countries. We've all seen, unfortunately, that no matter what, whether the country is part of their advanced economies, part of their emerging economies world, developing world, health systems in all our countries have shown their total unpreparedness, or at least partial, at best, unpreparedness to deal with the health crisis. And thus it showed that a lot of way too much attention from the governments is given to health security issues, while today, and it was before like as well, but today even economics understands that human being is at the very center of our universe. And thus not a single country would not be able to develop without its main capital value, capital unit, which is a human being. And that brings social issues even more to the forefront, even more to their top agenda of all the countries. And thus I hope during today's roundtable, first but definitely not the last, including in this topic, we would be able to discuss issues like biological safety, medical statistics, vaccinations, all those areas that are that have shown the vulnerabilities and fragility. Sorry, I think the digital infrastructure is another problem that that became very relevant and understandable during the COVID pandemics. But we're here to discuss basically what is this that the civil society can suggest in all those areas in order to make the lives of our population better, in order to not only overcome consequences, negative consequences of this particular pandemics, but also to make sure that we can act together and work together to prevent such difficulties and such crises ahead of us. I'm really asking you to be very sincere, to be very open, and to share your views and ideas. And I can assure you that we will be using all your inputs for the best, for the development of the BRICS process, for their suggestions to form to the leaders as a result of their civil forum, which we still hope to have a face-to-face later this autumn. And this roundtable will be given the first contribution to this very important document for this year and further on. I would like to now give the floor to Stepan Kanakin, who will be moderating this roundtable, and I would like to wish us all luck and bright ideas ahead of us. Thank you.
Victoria, thank you very much. Thank you very much for your introduction. I believe that we'll try our best to have a fruitful discussion today. And let me introduce myself again for everyone. My name is Stepan Kanakin. I represent both Russian NGO 18 Pushaya Foundation and also the Civil BRICS Forum Secretariat. As Victoria told, and of course, all of you know that Russia is hosting the BRICS Summit this year, and one of the traditional events within BRICS process is of course Civil BRICS Forum. It serves to consolidate the civil priorities, to prepare recommendations on behalf of BRICS civil society organizations and NGOs for the BRICS leader. For that purpose, we have our web platform, civilbrics.ru. You can use this platform to get more information about us, to understand how you can be involved, how to get update on our calendar, and to get more information about history of the process, to send your recommendations, of course, to get in touch with us. So please visit it and join our process. As Dr. Panova mentioned, to prepare recommendation, there are 8 working groups. One of them is food and healthcare. Today, I'm very glad to welcome you all here at the online kickoff meeting of this group. It's called Public Health Systems Response to Epidemiological Threats in BRICS member states. Thank you for your interest and for joining us today. The agenda of our roundtables is really large. It's COVID-19 outbreak, biological safety, effective mechanism to respond epidemics, biological threat prevention, drug-resistant infection risk management, role of WHO and other international institutions, and so on and so on. But we have only half an hour and a half, and our discussion today will focus on 2 things. First one is a brief observe of the situation with COVID outbreak in our countries, and second is its issues related to medicines, treatment, vaccination. We have 3 speakers online today. Mr. Pedro Velarde, coordinator of Intellectual Property Working Group at Brazilian Interdisciplinary AIDS Association from Brazil. Mr. Sergey Golovin, head of Intellectual Property and Accessibility Division at Eastern Europe and Central Asia Treatment Preparedness Coalition from Russia, and Ms. Kajal Bahwai, independent expert on health and Human Rights, leader in the Access to Medicine movements from India. Before we start, I'd like to remind you some technical details. Please keep your microphone on when you speak and turn it off when you don't. Also, please note that after every presentation, the speakers are ready to answer your questions. We will also welcome your comments and suggestions. If you like to ask, please push raise the hand button in the Zoom menu or use the chat. If you use the chat, please don't forget to write your name. Me and my colleagues, Ksenia and Valeria, are ready to help you. If you have any technical difficulties, please just let us know. We're about to start, and I would like to give a floor our fellow. It's Mr. Pedro Velarde. Pedro, you have 15 minutes, please. We would like to hear you.
Hello, everyone. I would like to thank very much this opportunity to share some thoughts with you. I'd like to thank the invitation to be here at this virtual roundtable. And Dr. Panova, I also expect that soon we'll be able to connect face-to-face again. Briefly, I'd like to share some topics with you. Let me present myself again. I'm Pedro Velarde. I'm the coordinator of the Working Group on Intellectual Property, a coalition of 19 NGO social movements, unions from Brazil. We've been working on this access to medicines and intellectual property field for the last 17 years, almost 20 years now. And the GTPI, which is the acronym in Portuguese, is coordinated by ABIA, the Brazilian Interdisciplinary AIDS Association, which is a 33-year-old NGO working on the field of HIV/AIDS and public policies related to health in Brazil. I'd like to talk a little bit about the COVID situation in Brazil. We've passed 1 million people infected with COVID-19 sometime now. We are almost reaching 1,300,000 people infected, and we are almost reaching 60,000 people dead of COVID-19, which is a huge number. Nevertheless, it's very clear the importance of our public health system, the SUS, is how we call it. It's a universal, free of charge public health system, which certainly avoided many, many deaths. We also have to remind that SUS is under a strong financial constraint after the Constitutional Amendment 95 was approved by the House of Representatives and the Senate in 2016, which does not allow the federal government to increase the expenditures in health for the next 20 years. So this is the context in which our public health system enters to face the greatest health challenge of the century with a huge financial constraint. The federal government is not allowed to increase the expenditures in health even during the pandemic. Of course, we have to state how disastrous the conduction of the Brazilian government to answer this pandemic have been. We've been without a Ministry of Health for the last month and a half now, almost 50 days without a Ministry of Health during a pandemic, during the worst phase of the pandemic. Many governments and mayors are starting to reopen their cities and states without any confirmation of the reduction of the transmission rate. which is very much worrisome. And there's not much perspective on how Brazil can retake its activities without putting in danger its population. This is very much because we have a president that denied the pandemic, denied the gravity of COVID-19 outbreak, and there was no public policy put in place to face this huge challenge. Nevertheless, the House of Representatives and the civil society is trying to do their jobs. And I say this because from our perspective, considering that the pharmaceutical industry have shown in their history no signs of collaboration, no signs of solidarity, and no signs of any posture that could suggest a different outcome during this pandemic, other than enforcing their monopolies, enforcing their crazy race to profit. The civil society and the House of Representatives are trying to propose a law bill to automatically issue compulsory licenses to all COVID-19 related technologies. This is because in Brazil we have a legislation to issue compulsory licenses. For those who are not very familiar, compulsory licenses is when the government takes action and suspends a monopoly related to a patent that covers a health technology or any other technology. In this case, we're talking about the COVID-19 related technologies. And this is very important because Brazil wouldn't be attached to any patent that could hinder the state capacity to purchase medicines or vaccines or diagnostic kits or ventilators or anything like this. This law bill is being discussed in the Brazilian House of Representatives, and we believe it's very important to have this law bill approved so that Brazil wouldn't be attached to any monopoly that could diminish the state capacity to purchase, or even not relying on the capacity of any pharmaceutical company to sell any vaccine or medicines to Brazil. That said, I believe that being in a BRICS roundtable, there are a few messages that I think the BRICS countries should together embrace. The first of them is considering the ability to supply of those pharmaceutical companies, which are very much in question now. First of all, because European countries and United States are practically purchasing in advance many of the production, most part of the production. So for big BRICS countries, especially those without a strong production capacity, which is the case of South Africa, may be without access to vaccines or medicines when this vaccines is proven its efficacy. So Brazil has some production capacity, especially with the Instituto Butantan and Biomanguinhos. Nevertheless, if there is a monopoly in place, it's very difficult that Brazil will be able even to import. So the first thing I believe BRICS countries should have a strong strategy of coordinating production and distribution of vaccines and other useful medicines. This is because we cannot rely on the goodwill of pharmaceutical companies or other countries such as European countries and United States. So there should be a very strong strategy combining both production and distribution of a vaccine when there is a vaccine that's proven its efficacy. Then we believe that the BRICS countries should declare very strongly that there can be no monopolies on those technologies, on vaccines or medicines. There can be no monopolies. And the BRICS countries should issue a very strong statement saying that the countries must be able to use TRIPS flexibilities without being pressured by developed countries such as United States or European countries. Following the Doha Declaration and following the recommendations of the high-level panel of convened by the Secretary General of the United Nations in 2016. I believe that those were the messages that I wanted to put on. I'm available to answer questions, and thank you again for this invitation.
Dear Pedro, thank you very much for your speech. Thank you for your proposal to the BRICS dialogue agenda. Dear friends, note please that due to the unavoidable circumstances, Pedro will leave us very soon, like in 10 minutes. So if you have some question, please push right hand button or send your message to the chat.
I have like 15 minutes, Stepan.
Okay, great. 15 minutes.
And I'm so sorry to leave earlier. I know it's very unpolite, but it's really, I really can't state. I'm sorry for that.
Please don't. It's okay. Okay, I can see no question, right? Valeria, can you help me? Can you see anything in the chat?
There's a question on the status of the law bill.
Yes, I can see a question from Hardwire.
Yes.
Cajal.
Pedro, what is the status of the bill in the Brazil?
Okay. So the bill was presented by a member of the parliament on early April, and it was presented on an external commission of the House of Representatives, exclusively created to discuss the coronavirus outbreak response. And there was a consensus in this commission in regards to the law bill. The law bill number is 1462-20. I can write down in the chat box later. And currently, it has a urgency status pending to be voted. After this pending status to be voted, it has 45 days to be voted by the House of Representatives. We're trying to push it much faster, but there's huge resistance by the pharmaceutical industry, so it's not easy. So the bill is pending now, unfortunately. We believe that it should be approved as soon as possible, since it can prepare Brazil to deal not only with this pandemic, but with other pandemics, since the text of the law bill foresees that it should be valid not just for this COVID-19 pandemic, but for other public health emergencies.
Thank you, Pedro.
Stepan, if you allow, I have a small question. Pedro, as you know well, it was in 2018, right, that the BRICS countries have agreed on their vaccine center in South Africa, right? So it was South African initiative. We still don't have it. So what do you think should be, probably what should be the actions and further steps of the 5 countries to ensure that such vaccine center is actually established and that it is efficient, and probably what else needs to be done? So what's your view?
Thank you for this question. I think there can be no better time to put this in motion, right? And I believe that the countries should have a coordination mechanism to have a technology transfer as soon as the vaccine is proved proved its efficacy, and to produce it in large scale. I'm not very much aware of the status of how fast this could be put in place in South Africa, but I believe that other countries have a strong production and distribution capacity, especially China and Russia and India, of course. And I believe that if there is a coordination mechanism to produce and distribute vaccines, not only within BRICS countries, but with a solidarity spirit for other countries, especially those of middle-income countries, which will not be included in any donation programs and will be excluded from access of these vaccines. This should be done now. It's the time to put this thing in motion, because we are very much sure that many countries, many middle-income countries, will be without access to vaccines. And if there's a medicine that is proven its efficacy, will also be without access to it.
Thank you, Pedro. I can't see more questions for now. Maybe a little later. So
we have question. Stepan?
Great.
Yeah, there is a first
social distancing, right?
Yeah,
And
one question from
the hand. So
yeah.
Please take two questions.
So the first question was from Maria, and the second one is in the chat from Svetlana.
Yes, thank you. It's right, Maria, it's me. And if I may, please, Pedro, accept my sincere gratitude to you for very informative insight of the current situation in Brazil that happens after and during the coronavirus outbreak. However, my question will refer to the impacts of this pandemic situation on the migration flows that may occur to neighboring countries, like how badly it impacted the migration flows, because it also refers to our today's agenda on food and healthcare. So if you're aware of the situation, could you please share this information? Thank you.
Thank you for this question. I actually have no concrete information on that. It's not really my field of expertise.
Okay.
I can leave my email on the chat and try to get any contacts that may have this information and pass it along to you.
All right, thank you. Anyways, thank you.
Thank you, Maria. And Pedro, please, there is another question from Svetlana.
Regarding social distancing.
Yes, it's Shana Chubarova asking what is about social distancing in Brazil. Is it working now?
The quarantine, as I don't know if it's correct to say in English, but the social distancing policies were put in place on March 15th, I guess, 14th or 15th, almost 3 months now. And during the first month, there was a kind of respect by the population. After the first month, a huge decrease in the level of adherence of the measure, and then they went up again. But since there was no lockdown of many cities, and I believe the social distancing policies were put in place in a wrong manner, because all the Brazilian territory was under social distancing at the same time, and there were, outbreaks in some cities, but now in the whole territory. As many of your countries, Brazil is has a huge territory, So it was not very smart to do that. And eventually people got tired of it and started to go out, and cases started to grow. There was huge uncertainty on the government policies to assist those who wouldn't have an income staying at home. That took very long, so people had to go out to survive. And also I have to remember that the social distancing was not practiced by the president himself. He encouraged demonstrations in favor of himself. he went out several times to eat hot dogs and promoted gatherings. So there was not a strong message by the president himself to people respect the social distancing, even though governments and mayors tried to implement measures. Those were consistently challenged by the president himself. And we have to remember that that was why the first minister of health fired during the pandemic. That was the reason that he was fired, because he was going against the president, defending the social distancing, while the president was calling just a little flu, the coronavirus, just a little flu that wouldn't affect people that had athlete background. He said that on national broadcast in for the home country. So it was very difficult. The Brazilian population did not respect the social distancing very well. There was no lockdown under any time, and what people was discussing both in the media and both in specialized communities, that if there was a lockdown such as in Europe, for instance, like for 2 months, people cannot go out, they could be fined, they could be detained even. If there was this lockdown measure and not like voluntary social distancing rules, it could be much more effective than 3 months of non-effective social distancing. I don't know if I was clear.
Pedro, thank you very much for your evaluation of the situation with the lockdown measures in Brazil. As far as I understand, there's no more question for you right now. So let's move on. And I would like to give a floor to our next speaker, Mr. Sergey Golovin, who is head of Intellectual Property and Accessibility Division and Treatment Preparedness Coalition. Sergey, the floor is yours. You have 15.
Yep. Thank you very much, Stepan. I hope you can hear me. If yes, please drop a line in the chat, if it's okay. I'm sorry for not being able to turn my camera on. This is due to technical reasons. My laptop, this particular laptop, does not have a camera, unfortunately. But I'll be able to demonstrate some slides, I think. And Stepan, do I have the possibility to do the screen demonstration? I think yes. Okay. So
Okay.
can you see my screen now?
Yes.
Good.
Great.
Thank you. So yeah, to start with, just briefly what our organization does and how we are involved in the COVID-19 pandemic, although I think pretty much every organization, every civil society organization working in the field of public health is to some extent involved into the COVID-19 response. So we are primarily an HIV and hepatitis C and TB organization working in the field of treatment indication, treatment literacy, drug procurement monitoring, intellectual property and access. And when the COVID-19 epidemic started, so there were several situations we faced, and the patients living with these diseases faced in Russia that we had to deal with immediately. There were people stuck abroad who couldn't come back without, and they needed therapy, they needed drugs, so we tried to help them. Then there were some issues with the supplies of drugs. There were we had information that supplies of some antiretroviral drugs had to be the time for supplies had to be changed due to this COVID situation. So this is something we also try to understand. And of course, there were HIV drugs that were tested against COVID-19. So this was another angle we had to look at COVID from. And but then gradually, this experience we have gained in the field of treatment access in relation to HIV and hepatitis C and tuberculosis, all those diseases that significantly affect the BRICS countries, I think will and can be used for COVID-19 as well. So just a couple of words about the epidemiology. I'm sure you're all aware of that the BRICS countries have been significantly affected by the COVID-19 epidemic. And if you look at the statistics right now, I think that 3 out of 5 countries with the largest absolute numbers represent BRICS. So we're talking about Brazil. And Pedro, thank you very much for giving more detailed information about the Brazilian case, and also Russia and India. And I think there are some worrying trends about, I'm not sure about Brazil, but I think India, but Kajal, the next speaker, I think she has much more information about it. But one of the worrying trends is that the numbers continue to rise, I think, in India, at least. In Russia, the situation is gradually stabilizing if we look at the official statistics, but I think the absolute numbers are still big. The mortality rate is lower than elsewhere, but still, if we look at absolute numbers, I think it's a huge impact still. So BRICS countries, luckily or unluckily, it depends on how you look at it, but we have a history of developing comprehensive responses to large-scale epidemics. Again, we can look at the example of HIV, we can look at the example of TB, and something that Pedro has already mentioned, and I think Victoria has also mentioned, that we have some advantages, and that we have developed these comprehensive responses related to improving access to therapy. Our countries have the capacity to run our own clinical trials of drugs and vaccines, and we have set up a pretty robust manufacturing facility for drugs, for testing and vaccines, and even now in COVID-19 we see that our countries are starting to develop some of the drugs and starting to implement some vaccine trials. So this is an advantage, and I think this vaccine center you've been speaking about, I think this is a good opportunity how we can merge those strong sides to take advantage of each other's facilities. Our field of specialty is treatment, and the rest, the remainder of this presentation will be mostly about the COVID-19 treatment as it is now, and opportunities to scale up treatment to it once it's available and approved. And all of this will be linked to IP, something as Pedro already talked about. So the COVID-19 treatment, there are no basically approved options yet. By approved options, I actually mean options approved in accordance with the evidence-based medicine. So we're still waiting for many trials to generate results. I think we're still waiting for the large WHO solidarity trial. There are some signs of success for certain drugs, so others do not show that well, so there are mixed results. And the important thing is we're testing existing options for other diseases to spare some time, because it's the fastest way to try to test something that is already on the market, so we know about the safety of the drug. We need to prove whether it's effective against COVID. And importantly, there are known IP challenges, intellectual property challenges in relation to some of these drugs. I'll be mentioning some names such as remdesivir or sofosbuvir. So we know already from our experience and in the BRICS countries as well that there are IP challenges related to these drugs, and in order to overcome them, if they prove to be effective against COVID, we need a comprehensive set of response. For some options, IP appears to have less implications for access. If we look at Russia, Russia has already launched, I think, already more than one generic version of favipiravir. This is another experimental drug, which is being tested and used in clinical settings and as standard of care, waiting for more results to be generated. And there was another drug for which patent rights have been waived after some countries started to implement compulsory licensing measures, such as Israel. It was lopinavir ritonavir. It was also used for HIV. But we're still waiting for the results of the trials, and the trials we have now, they do not really demonstrate that great efficacy of this particular drug. Importantly, research shows that these drugs can be produced with a profit at a very low cost. So just some examples listed here. Thanks to Dr. Andrew Hill and his colleagues from the University of Liverpool, we know, for example, that remdesivir can be produced very cheaply. The cost can be as low as $0.93 US per day. And favipiravir, for instance, can be $1.45 for a daily dose. So a scale-up is possible, but how we achieve this scale-up is another issue. So we're looking at the licensing initiatives in place in COVID, and this is global. This is not about only BRICS countries, but we have, like, for example, a large voluntary license agreement announced for remdesivir, but we have only India and South Africa covered by this agreement out of the BRICS countries. So Russia, China, and Brazil are excluded from this particular licensing agreement, and remdesivir is one of the drugs for which we have data demonstrating efficacy, at least some efficacy in some groups of patients. And there are also large agreements announced covering experimental vaccines, and there is a Costa Rica proposal creating a pool of technologies to combat COVID-19. But we are yet to come to a comprehensive response that will meet all the needs of the countries, and we're not still there yet, unfortunately. At the same time, governments globally are taking measures to ensure patents will not be an issue when we have effective drugs, when these drugs prove to be effective. Interestingly, these are mostly rich countries from Europe, for instance, Canada. To cut the story short, you can, I think, read the slides, but I'll just briefly explain what these changes are about. So they're basically giving more power to the government to act and to use inventions in case of a pandemic for public health measures. So in Canada, in Germany, and I think Israel I've already mentioned Israel, Hungary, and there are more examples that can be found on the website of WHO. And I'm very thankful to Pedro for talking about the Brazilian example of a new law which is being discussed. And there are similar initiatives in some of the other countries. And I think the BRICS countries, they were once very successful in introducing IP measures in relation to HIV. And I think it's really time to do the same for COVID. And the civil society is also acting. also acting in these countries as well, in other countries as well. We see civil society organizations already opposing patents for some of the drugs. We see calls for actions. We see open letters to governments to revise IP laws and refer to government use in several countries, Morocco, many countries in Eastern Europe and Central Asia, Scotland, I think, and other examples. And here in BRICS, I think we also need to do something more such actions, and I think Kajal will cover more information about India. As I've mentioned before, so our countries in BRICS have a very good history of well, not maybe a very good history, but a good history of using compulsory licensing. Brazil 2007, compulsory license for efavirenz. India 2012, compulsory license for sorafenib. And in Russia, we also have some cases related to court issuing CLs for a couple of oncology drugs very recently. So there is a good experience, and based on this experience, I think we can move on in the field of COVID as well. And for the opportunities related to compulsory licensing in Russia, they look promising, but more needs to be done. And I would like to draw your attention to the last line in this slide is a draft law to introduce changes to Article 1360 of the Civil Code. So we basically here need to add a line and add this language in the interest of life and health of citizens. So in the interest of life and health of citizens, our government can use inventions for medicines as well. So to conclude, so basically the key messages I wanted to deliver is while we are waiting for effective treatment, I would like to remind you that we're still waiting for the results concerning some drugs. We have promising signs related to certain drugs such as remdesivir, maybe favipiravir. Our countries are testing some other drugs. In Russia, there are clinical trials of other drugs related to COVID-19. But while we're waiting for the effective treatment for COVID, we need to get ready to overcome IP barriers, if there are any, because this is a lesson we once learned in HIV. This is a lesson we used for making hepatitis C treatment more accessible at a faster rate than HIV. And I think for COVID, as we see, it's even more important, and it's even more important we act faster. So some countries are already using it, and I don't see why the BRICS countries, who have such great history of developing comprehensive response to other epidemics, should not do the same, or even more, I think. So COVID-19 is an extremely important field for developing these comprehensive responses in the field of IP and treatment, testing, vaccine access interventions. So thank you very much. If there are any questions, I'll be happy to take those.
Sergey, thank you very much. I really like your presentation. It's very interested, very relevant, and very detailed. And thank you for your call for BRICS Nation to be more active in this issue. And I can't see question now. Let me check the chat. Okay.
So there is a question from Anton Zhukov.
Mm-hmm.
Yes, please, you can. Yes.
Can you join us?
Yeah, right. Yeah, I'm not actually Zhukov, I'm Zykov. I represent Médecins Sans Frontières, Doctors Without Borders. We are the biggest independent and independently funded medical organization, and we work now in 70 countries with COVID response, especially in conflict zones. Right. So my question to Sergey is, I think there was a bit of unclarity about the IP for vaccine in Russia after what the president has said, I think in mid-May, when he talked about the need to ensure Russia's intellectual property on the vaccine. There was a meeting with some scientific bodies that were developing this vaccine. So I wonder, do you know more if the situation has changed since mid-May? What's the current state of IP for potential vaccine that is, we know, being developed in Russia? Thanks a lot.
Oh, thanks. This is a really great question. I have to say I have not been on this particular topic. I don't know if there has been any change in this regard. And what I can say is that
Sergey,
yeah.
Sergey, I'm sorry, we can't hear you. We can't hear you well.
Can you hear me now? Because I think
yes.
Yeah,
yes.
The mic is on. Yeah, this is a great question. Unfortunately, without a great answer, because I've not been following this particular situation. I'll promise to look a bit into more detail. If I find out anything, I think you can contact me via Stepan and find out my contact details, and we can talk about it more. But I think also we need to wait for the results of these particular vaccine and see whether it's proof effective, and for the IP status, I think I need to find out a bit more about it.
Thank you, Anton, for your question. Sergey, thank you for the answer. Also, we have question.
Not much of an answer.
I'm sorry?
I said it was not much of an answer, but still, I think it's a very important topic to be investigated. So I'm really thankful for the question.
Yes. Thank you, Anton. Also, I have questions from Andrew Doman. His question is, what is the role of WHO in the issue that you have mentioned?
Well, the WHO, I'll leave part of this message to the last speaker, Kajal. She knows, she has more information about it, but at least a couple of roles for WHO is that WHO is running several trials now to demonstrate the efficacy of some drugs. The Solidarity trial I mentioned already, and I think WHO should play, well, in this Costa Rica proposal I mentioned, I think WHO should play a role in managing this particular pool of not only patents, but I think it also relates to technologies, know-how, and other forms, different forms of intellectual property in the field of COVID. So I think according to the proposal, WHO should play some kind of a administrative role, but I think Kajal will have more details on this. Also, I think historically WHO has at least in the field of hepatitis, WHO did produce some of the IP landscapes for the first hepatitis C drugs. Then this role was gradually taken by civil society organizations, by the Medicines Patent Pool. The Medicines Patent Pool is an organization that deals with drugs and patents, and I think they already have a mandate for working with COVID. This is a UN-backed organization, so there is some, although indirect link to WHO. So yeah, there is a certain role. So these examples I can give you right now, and I think the rest of the examples I think can be also covered by Kajal, the next speaker.
Thank you, Sergey. I think we will discuss it more with Kajal, and we have also one question from Irina Chepekina. Irina, I see you. Would you like me to read your message? Okay.
I can read. Yeah, I can read. This is the question from Irina, right? Okay.
Yes. Yes. Mm-hmm.
if there are confirmed agreements between leading medical institutions, again, vaccine is, I have to apologize, I'm more into drug development. So vaccine is, I've been following some COVID vaccines, mainly this new AZ1222. I don't remember the exact name. So unfortunately, I can't tell, but I can try to find out later on. So for vaccines, I'm not really an expert.
Okay, thank you, Sergey.
Thank you.
Thank you everyone for your questions. Okay, let's move on to our next speaker. And first of all, I would like to I'd like to say sorry to Ms. Kajal Vartafaya for the mess with her time connection. I'm really sorry, but you're here. I'm really glad, and you're very welcome to speak. Please, you have 15 minutes. The floor is yours. Kajal?
Yes, hi. Yeah, don't worry about it. I'm just glad we found out in time. But you will have to excuse me for not looking formal. This is my lockdown version of formal wear. So I apologize to the participants for that. And just give me a second. I'm not great with technology, so let me see how I work showing you the presentation. And if it doesn't work, then I'll just speak. So just a second. Okay, did that work?
Yes.
Yeah.
Yeah, okay. Great. Okay. So actually, I think a lot of the issues that I was going to address in terms of treatment and access have actually been covered really well by both Pedro and Sergey. And so what I thought was I'd focus a little bit on something else that the organizers had asked me to do, which was talk a little bit about what the situation in India is, particularly in terms of the increasing numbers and what our experience has been in terms of health systems. And then maybe I'll close with a few of the issues related to treatment, though it'll probably end up being a bit repetitive. So unlike Brazil, and it was interesting that Pedro spoke about the fact that, if they'd had a lockdown earlier, perhaps the numbers would have been lower. India had a very early lockdown that actually started towards the end of March. And it came quite suddenly with absolutely no warning for anyone. Most other countries gave their citizens at least 4 days, 7 days to prepare. But in India, it came with absolutely no warning. There was a one-day lockdown announced, and then the following day, there was a complete lockdown announced across the country. So it wasn't specific to hotspots or areas where you were seeing outbreaks, which were primarily large cities like Delhi and Bombay, which had international flights coming in. The lockdown was imposed across the country. What happened as a result of that, because we have a lot of migration that happens from rural areas to urban areas for work, was within a few days of that lockdown being announced, we started seeing images in India that I think will haunt us for a generation and probably generations to come. There were hundreds of thousands of people on the streets, on the roads, who were simply walking back from cities to their villages because their work had stopped. So they couldn't pay rent, they didn't know where food was going to come from. And so the photographs that you see on the left-hand side are just, just some of the images that I'm sure most of you had seen in March and April coming out of India, of people just marching home, walking home on foot because everything had shut. There were no buses, there were no cars, there were no trains, there was no other method of transport. So you suddenly had this mass sort of exodus of people out of cities going back to their villages. And it's not like they were going back to their villages where, you have romantic ideas of lush green fields. They were going back to spaces of poverty that they had tried to escape. So I think this was sort of the defining images of the lockdown in India. On the right-hand side, at a much more micro level with organizations and groups that one works with, what we saw quite inexplicably was the shutdown of hospital OPDs, outpatient departments. We saw huge disruptions to health services. So on the right-hand side, you see friends from the Delhi Network of Positive People with their bike. And I'm not sure if you can read the message, but it says HIV medicines provider so that they wouldn't be stopped by cops or beaten up by cops during the lockdown. where they were literally going to their members and delivering ARVs. Because people simply didn't have public transport to go and pick up their medicines. We also know there's been a lot of disruption in terms of TB testing, in terms of hepatitis C as well. There's a lot to say about the lockdown, but I think there's not enough time. But I just want to do the highlights of what a planned or an unplanned lockdown may sort of look like. It's also the reason there is very little political appetite now for lockdowns in India. And now as the cases are going up and where you may need restrictions, it's becoming difficult to have that conversation. In terms of unlocking, I think these figures are plain to see for everyone. We didn't actually have any real stopping of the increasing of numbers, but as the lockdown was gradually lifted, it's still then in some restrictive ways, but in many of the cities it has for all intents and purposes been lifted. We have seen a massive increase in numbers. We're 500,000 now, where I think Brazil leads us, Russia leads us, but many experts are saying that we will be surpassing these numbers very, very quickly. So we're seeing a huge increase, but it's difficult to talk about India as just one monolith way of seeing numbers increase. There's hotspots in Delhi and Bombay where there's the maximum number of cases at the moment, and gradually other states and rural areas are sort of picking up and seeing these cases expanding. So at a federal level, we have a central government and a state government. There's a lot of adjustments being made of how to deal with the unlocking, how to deal with economic activity coming on board. But you see this massive sort of increase in cases. I noticed that one of the interesting conversations on the agenda was about what does this mean for health systems. In India, we have a very interesting mix of public health and private health. And over the years, there's this gradual migration for most people preferring private healthcare. And that ranges from top-level corporate hospitals to very small nursing homes to a clinic run by a private doctor. And we're starting to see what that means in the context of COVID. And it's impossible to give you a pan-India image. So I'll talk about the city that I'm in Delhi, which is currently, we're at 80,000 cases at the moment. Mortality is relatively lower compared to other countries. So at least in Delhi, it's 2,000, and overall in India, it's about 16 or 17,000 people who have passed away, assuming we can say that the death figures are actually accurate, because there's a lot of impact on non-COVID, but let's not get into that. So what have we seen in Delhi through the lockdown and through the unlocking? There's a lot of, I think at some level, there was some actual belief that the lockdown would stop the numbers. And now, of course, the narrative is, well, the lockdown was meant to buy you time, which is absolutely true. It was meant to buy time for the health system to adjust. But what we've seen in Delhi is we're seeing a lot of hits that the health system is taking. Firstly, in terms of healthcare workers, we've had over 2,000 healthcare workers who've tested positive for COVID-19, and that's in Delhi alone. So in terms of health personnel, we're seeing a lot of people who are unwell, and because they tend to be exposed over and over again into high viral loads, we're also seeing an increasing number of deaths amongst healthcare providers. We've also seen this very interesting phenomena happen in Delhi, where even government officials, when they test positive for COVID, are going to private facilities. And this tends to give a very strong message about what the government's own belief is in its own facilities. And it's quite a worrying thing. So if you look at the government hospitals in Delhi, almost half of them have vacant beds for COVID-19, but the private beds are almost completely full. And this is an interesting dichotomy that's happening of how much faith even middle class or lower middle class people actually have in the government healthcare system. Since there's so much emphasis on the private system, there has been runaway profiteering by the private hospitals. And we've seen that in Delhi, we've seen it in Bombay, we've seen it in multiple cities. These figures that you see are actually in Indian rupees, but vaguely for a general bed for a night, it's about $300. And if you need to be in the ICU with a ventilator, it's $1,000 a night. So people were coming out of these hospitals with bills of $10,000, $15,000, $20,000. So there has been rampant profiteering by the private sector. And for some incredible reason, our governments have taken very, very long to step in and to regulate the private sector. We have now sort of had the government step in and asking both, we had a massive shortage of beds actually in the beginning of June, and a lot of deaths as a result of that. You had really heart-wrenching stories on social media of people going from one hospital to another, literally in an ambulance or in their like carts or three-wheelers, and taking the patient from one hospital to another and being told there are no beds, and then finally dying in front of a hospital. Many of them actually just needed oxygen. like not even anything else. Many of them just needed oxygen to survive that. And many of those stories finally led the government to acting. And so now there are increasing number of beds that have been reserved, and treatment prices have been capped. But there's a lot of nuance in that, which I think we don't have time to get into. In Delhi, we now also have the largest makeshift sort of field hospital that has come up with 10,000 beds. About 100 of, I think about 10% of these will have oxygen with them. And if somebody gets critical, then they'll be moved to actual hospital cares. Hotels have been converted into bedded facilities. Banquet halls have been converted into bedded facilities, because we're expecting, at crazy estimates, to have 500,000 cases in Delhi alone by the end of next month, though experts are worried about that. But one of the things that a lot of civil society have been trying to have a conversation with the government is that the beds are simply not sufficient. You actually need manpower for it. And we just don't have that. The nurses are extremely overworked. They're exhausted out of their minds. Doctors and residents are being drafted in. And we're actually seeing so many stories of elderly healthcare workers who are dying from COVID, who should not even be at work, but they are there, they're volunteering because they can see what a massive shortage there is. So overall, in terms of understanding the pressures on the healthcare system, like I said, I haven't given you a Delhi, an India example. I've given you a Delhi urban-centric example, where this is the capital of the country. We actually have a lot of central government hospitals, state government hospitals, private hospitals, and we are struggling. And of course, there's no question of any more restrictions on people or economic activity. So, let's see what next month brings. I'll move on to some of the issues that I think Pedro and Sergey were talking about in terms of what's happening in India, at least in terms of treatment. So India has a long history of generic production. We're known as the pharmacy of the developing world. There has been a lot of action in terms of whether these medicines are going to be available in India or not. Remdesivir has been approved. It has been given emergency approval in India. Favipiravir, which I believe Russia is probably the only other country, and we follow second, has also been given emergency approval. I have to say that for Favipiravir, we still don't have published data from the generic company that has launched it. Though they have claimed that, you have to take 18 tablets on the first day and 8 tablets every day after, and they claim that, people are seeing viral clearance within 7 days, but where's the data for that? It still hasn't been published. But in any case, we've already seen these drugs coming onto the market. And with Remdesivir in particular, there has been a concern of its patent status. Because Gilead, which is the multinational company, has patents in India, what they have done is they've entered into licensing agreements with about 4 or 5 Indian companies, which means the kind of production that you would normally want to see for a drug that may be useful, which is a lot of companies making it both for India and for export. We have a very limited number of companies who are making it. As a result of which, you've had civil society groups like cancer patients who are worried about the impact of COVID-19 on cancer, asking for a revocation of these patents. We haven't heard anything from the Ministry of Health yet on this, because their approach to it is that 4 or 5 companies are in the market. Fine. Now, what these 4 or 5 companies means in terms of prices, and Sergey referred to this already, we have Andrew Hill's study showing that the prices should be $1 a day. The prices that have been launched in India per vial are close to $70. So this is despite the fact that you have generic competition and the prices should be much lower. Now the companies are claiming as more companies get into the market, you'll see lower prices, but let's see if that actually happens. So it's quite distressing actually to see an Indian industry which, at the height of the AIDS epidemic stepped out in the world and said, we will provide you treatment for $1 a day. We will provide it to every developing country. Now taking really restrictive secret licenses and pricing these drugs so high. Not even counting hospitalization costs. This is very high. This is extremely high for patients to actually pay. And of course, these companies have taken licenses, which also, as Sergey pointed out, means that they can't actually supply to the whole world. That said, there has been a little bit of good news coming out of Bangladesh, where companies in Bangladesh have actually launched Remdesivir already. In fact, they were the first to do it even before the Indian companies. They are not under any license restrictions, so you could actually, if your country is left out, approach them to try and get generic supply going. At least for Remdesivir. For Favipiravir, again, we're seeing high prices per tablet of the drugs. Let's see if that goes down. But like I said, one of the biggest questions for us at the moment is where is the data to back up Favipiravir? And let's see if that sort of gets published. Tocilizumab is another drug which has actually been used, to for people who are going towards a severe manifestation of the disease. And again, there is only one company that's marketing it, Cipla, and they have a tie-up with Roche because there are patents on it. And again, prices of these injections are extremely high. So it's pretty disappointing, you know, to be in a country where we're so proud of our status as being the pharmacy of the developing world, that we have got restricted by this system of patents and licenses and marketing. And I think civil society in India is trying to put a lot of pressure on the government to lift these restrictions so that these drugs can be available not just in India, but across the world. I'm actually going to skip my next few slides because I think they cover a lot of what Sergey and Pedro already covered. But sorry, it's actually just frozen. But I just wanted to give you sort of an image or a picture of how heavily patented these drugs are across our countries. So in the BRICS countries, the companies have come in and made sure that they have as many patents as possible. If you look at the last column, you see that their monopolies go on well into 2030, 2031. So it will take government action to actually deal with this crisis that we're facing. And I think it brings us to an important question for the BRICS countries, because as Sergey has pointed out, there's many developed countries that have taken action. But if you look at where the capacity is for trials, where the capacity is for production, it lies with us. China is the global producer for active pharmaceutical ingredients and raw materials. India is the global producer of affordable generics. Russia has national production and possibly regional production. Brazil is a national producer, potentially a regional producer. And South Africa has some national production capacity. But it takes vision and a lot of guts for our governments to actually step in and do something in a situation where there is a pandemic. And I hope as civil society, we can impress upon them how important it is to start taking that action now and not wait and watch to see what medicines and what treatment comes out. So I'll stop over there. Thanks.
Kajal, thank you very much for your presentation. It's really interesting.
I'm trying to stop sharing.
Okay.
Is that fine? Yeah.
I can see a question from Anton Zykov. Anton, please.
Right. Kajal, thanks a lot. It was a very interesting overview of the situation in India, and I fully share it, as I'm actually joining this call from Bombay myself.
Yes, so you can speak about what's happening in Bombay, which is also a disaster.
Oh, well, yes and no. So I work for Doctors Without Borders, and we're doing some response in India, along with other 70 countries, and Dharavi in Bihar, in Jharkhand. Anyway, one of the big things that MSF has been doing for decades is the access campaign, not just with regard to the current pandemics, of course, but with regard to HIV treatment, hepatitis treatment, TB treatment. And it was quite successful in India because of what you said, India being the pharmacy of the developing world. And this message obviously resonates with those pharma companies and the Indian government. So I wonder, what are, to the best of your knowledge, current efforts, either by civil society or maybe even supported by state governments or the federal government, towards promoting access to the vaccine when it is finally ready? Thanks a lot.
So I think in terms of medicines, I think as I already said, there is already quite a strong civil society movement towards challenging the patents on these medicines, and let's see where that goes. In terms of vaccines, we do have the Serum Institute, which is one of the Indian companies, which has said that it is already tied up, for the Oxford vaccine, which apparently is well on its way or is ahead in the race, but everyone says they're ahead in the race, so who knows? And they have already put in an investment to say that they would, I forget actually, I'm so sorry what the amount of the investment is, to have as many doses possible ready as soon as possible for India if that vaccine goes ahead. So you had this company making this announcement already, and I think it's a wait and watch to see whether that vaccine is actually going to be effective or not. There has been a bit of alarm in civil society that so many eggs seem to be in one basket. And there's already investment and capacity that Serum Institute claims that they have to already produce this. But that's in a bit of a wait and watch moment. I think at the moment there is so much emphasis on current treatment and current care and management of COVID. And I think a lot of people have the idea that we're not looking at a vaccine before the end of the year or next year. And it's one of those things of, that's a bridge to cross when you come to it. I think there is an innate belief within the Indian government, Indians generally, about the fact that we have vaccine production capacity. We have seen this being, in a sense, effective when there was the last H1N1 outbreak. And, we saw, it's extraordinary to see the same playbook come over and over again. When there was a vaccine for that, I believe the United States and Europe started stockpiling, and they said that there was no way a dose was going to leave their countries to get anywhere else until everyone who needed vaccine got it in their countries. And I suspect we will see that again when it comes to COVID-19. You had then Indian companies step in and start producing the vaccine. It took 9 months, but at the end of it, you had this big photograph of the health minister getting an H1N1 shot that was produced in India. So I think there's this belief that, when there is a vaccine, there will be the capacity to produce it, even if that's a bit delayed, and we will not be caught in the same circumstances as many other developing countries about, fighting for stocks. So I'm not sure as to how much preparation there is, but I think that Serum Institute announcement really sort of makes people believe that, yes, when there is a vaccine, we will be able to access it. I can send details of that announcement to you on the chat.
Thank you, Kajal. I can see raised hands and can see messages. But I would like to redirect the question from Andrei Derman. He asked Sergey, but I would like to ask you to answer. Can you see the role of WHO as a drug regulator, as a regulated market?
Right. Sorry, as a regulator in terms of the trials and the approvals, or do you mean in terms of the issues around access, or just generally overall? Well, I mean, maybe I can just...
I think that question was more general.
More general, okay, fine. I think the WHO actually has quite a strong role to play. It is our global health agency, and for all its weaknesses, it does have a convening power that many other agencies don't have. That said, as Sergey already said, there was a proposal to sort of set up a platform of a voluntary mechanism where companies could come forward with their intellectual property, with their data, with anything that could act as a restriction for other countries, and offer it up so that other countries could take up production. Because we know for a fact that even with expanding production capacities from multinational companies, they will not be able to meet global demand. So there has been this platform that was announced and that was set up, and let's see where that goes. It's very interesting because you see a lot of, there have been in the past commitments from a lot of tech companies and a lot of interest in making ventilators, making masks, getting around the IP on that. But when it comes to the diagnostics and to the treatment part of it, you see a lot of hesitation. You already have the companies speaking out against these sort of proposals and saying, well, we have our licensing and our mechanisms already in place. So I think any mechanism for the WHO to move forward is not going to be possible unless countries take action on it. And the best example that we have live is of Israel issuing a compulsory license for lopinavir ritonavir at the time that we believed that lopinavir ritonavir could be used effectively for treating COVID-19. And the minute Israel did that, you had AbbVie, the company that holds the patent on this, actually announcing that they were no longer going to enforce that patent globally, not just for COVID-19, but for HIV as well. So we know that when governments take action, companies fall into line. So the question really is going to be whether governments are going to take that action. So the WHO is going to be able to go only as far as the companies, countries back it up. So hoping for an epiphany, hoping that companies will suddenly find the humanity in them at this moment where their profits could, the opportunity for profiteering is so high. It's a nice idea, but I think it has to be tempered with proper action, both from civil society and the governments. We know this from the last 20 years of HIV treatment, that this has not, that kind of treatment available globally is not possible until civil society takes action and until governments take action. So hoping for the companies to do this on their own and for the WHO to be to attract all of them without us being involved in pushing that is I think a little too hopeful and flies in the face of the history that we have seen for the last 2 decades.
Thank you, Kajal. Also, we have one question from our chat. Richard Black, Chile Institute representative at the United Nations. We are proposing a head of state summit of India, China, Russia, and the US to take up coordination of the COVID and the economic crisis. Mr. Putin is organizing a similar summit. Would India support such a summit?
I don't represent the Indian government, so that would be very difficult for me to say.
You can speak
I think they would be. I think from the very beginning, when the whole hydroxychloroquine craze was there across the world, I think India took a lot of pride in sending hydroxychloroquine to many, many countries. I think there have been many announcements by the Prime Minister saying that, they want to play this international role. They want to be able to help. There's a lot of countries that have thanked India for sending medical supplies. So I think just going by that sort of thread or stream that one has seen, I suspect that the Indian government would be interested in this, but I do not represent nor am connected to or want to be with the Indian government. So I can just tell you what we've seen for the last few months and how India sees its role. For me, India's true role is going to come in when things get difficult, when you have patented drugs, when the companies are going to start behaving badly. And I think that's where we have to see the mettle of the Indian government to stand up saying that they will supply not just to all Indians in need, but to anyone across the world in need. And that's what you can really push for civil society.
Thank you very much. I can see some question from Anton in the chat to Richard. Richard, please check. And thank you for your question. Also, we have 3 minutes to finish our discussion. If you have any question, please raise your hands or write the message in our chat. So,
Stepan, I think really fast, I'd like to respond to Anton Zykov. I think what Richard Black meant in terms of what Mr. Putin is organizing, I might be wrong, but I think he's talking about the P5 summit, the Permanent Security Council Members 5 summit. It's a bit on different issues. So is this about it?
Thank you, Victoria, for your comment.
Yeah, it's just my suggestion, but I didn't get a yes or no from Mr. Black because I don't know anything on COVID response. I didn't hear of any other.
Yes, can you hear me? Can you hear me?
Yes, yes, yeah. Richard.
Yes, thank you, Victoria. I believe in President Putin's extraordinary article last week of June 19th, in again re-emphasizing the importance of a meeting of the Permanent Five at the UN. He outlined a whole series of topics to be taken up from the top by the heads of state of the P5, which would include the economic crisis stemming from the COVID-19 and the COVID-19 response question. So we feel at the Schiller Institute that such a summit, we proposed India, China, Russia, and the United States, without such international global coordination, that the required sort of combat response to COVID-19 would not occur. The fact that President Putin has been organizing clearly for such a summit is quite encouraging. Thank you.
Thank you, Richard. Thank you for your comment. Okay. Now there's no more question or comment. I can see. Yes.
Sorry, I couldn't figure out how to raise my hands. So
okay. Sorry.
My mic. Sorry. I was a very short comment on the vaccines and IP, because there were many questions related to vaccines, and at least from my side, not so many good answers. And I suddenly realized that we, being treatment activists, historically, there has been a lot of effort into those IP interventions related to treatment. And now, as we see this COVID-19 epidemic, I think there is a huge need to do pretty much the same road for vaccines, to do those IP mapping, to understand how IP around vaccines work, how all those issues related to scaling up access to vaccines and multiple production. So I think this area really needs to be explored and pretty fast, and we need to have, of course, more knowledge and capacity. We as civil society, and broadly, there has been more information around vaccines and IP globally. Thank you.
Thank you, Sergey. Thank you for your comment. Also, I can see a message from Kajal. This is vaccine production capacities map in the chat. Please check it out. Okay. We are running off our time. I would like to thank you all for your time, for your interest. It was really good start. We had a small but good, I would say, expert discussion. It was good analysis from Pedro, very detailed presentation from Sergey, and very interesting observe from Kajal. Thank you all very much. I'd like to remind you that it's only first meeting, first roundtable. We will have at least 11 more. Please visit stillbrinks.ru. You will find all relevant information, all dates and calendar. If you have any question or suggestion or recommendation, please do not hesitate. Contact me anytime. You all have my email. You all have my number. Thank you very much, and see you soon next time.
Thank you.
Thank you.
Thank you. Goodbye.
Thank you. Bye.